Hello, my name's Dr. Michael O'Connor. I'm a member of the Department of Emergency Medicine at Queen's University in Kingston. Currently, I am one of two co-leaders of the Emergency Department Wait Times Clinical Working Group. This group has met on a number of occasions and has gone through a process of initially establishing a set of priorities, and most recently we have actually gone through a careful carving process of these priorities to come up with three major initiatives which we believe in a 1 to 3 year time frame should have a significant input in the overall continued efforts at improving the kind of care that we offer for our patients across the Southeast LHIN who have some kind of an acute illness or injury and require care in either an emergency department or an urgent care center. If I was to summarize simply what are those three areas of priority or initiative that we have actually consistently and with consensus come down to, it would be number one, ensuring appropriate access to emergency and acute care facilities for all of the citizens within the Southeast LHIN as being number one. Number two would be ongoing efforts to ensure that the quality and type of care that we offer is of the highest standards. And finally, we have agreed unanimously that we must work diligently to ensure that our care offered in these sites is particularly focused on the needs of our older or seniors population. We all know that in southeastern Ontario we have a higher than average number of seniors, many of whom have made decisions to retire in this region, but we also know, as importantly, that over the next 15 to 25 years the numbers of our seniors who will be requiring care in the emergency department or urgent care centers will only increase as our population will actually change coincidentally with this kind of increased activity. As we work seriously to improve the overall performance of our emergency department operations, as we look to try and improve the skill set and the knowledge of our staff, this knowledge base and the educational efforts that we have to direct will be somewhat different than what has been traditional in the way that you prepare a health professional to work in an emergency department environment. In summary, we have great interest and great expectations that the Emergency Department Wait Times Group, as part of the Clinical Services Roadmap project, has every opportunity to make some significant changes over a time frame of 1 to 3 years that will be practical, that will be achievable, and that will not be linked to a high price tag necessarily. These changes, if they can be implemented, have the opportunity or the potential to set the stage for many years to come. Clearly, our working group is at the point where we're looking at drafts. We very much look forward to the next stage whereby there'll be additional input sought as part of an engagement process through a variety of methods. We will be drafting a series of questions that we want community members and members from rural areas, for example, within the Southeast LHIN, to provide their input and to provide their actual comments as to the way that we have decided at this point that we think our priorities and initiatives should be established. That additional input will be the final piece of the puzzle before we actually get into a plan where we'll be implementing some of these different ideas and strategies.